Hi, I'm Tara Schmidlin, the CPMC genetic counselor. Before you view your results, I want to give you some information about what the results can and cannot tell you. When viewing your result for any condition, it is important to remember that the testing done as part of the CPMC study only looks at disease risk. CPMC test results are not a medical diagnosis. Pancreatic cancer occurs in the tissues of the pancreas, a pear-shaped organ located behind the lower part of the stomach. The pancreas secretes hormones, like insulin, for sugar metabolism, and enzymes that help digest food. The most common type of pancreatic cancer, called exocrine pancreatic cancer or pancreatic adenocarcinoma, begins in the cells that line the duct of the pancreas. Cancer can also form in the various hormone-producing cells of the pancreas. This type of pancreatic cancer is rare and is called islet cell cancer or endocrine pancreatic cancer. Pancreatic cancers are often associated with a poor prognosis because they typically spread very rapidly and are not often detected at early stages. The CPMC looked at 3 genetic variants associated with the more common exocrine pancreatic cancer. Pancreatic cancer is the 12th most common cancer in the United States. About 1.5% of men and women will be diagnosed with pancreatic cancer during their lifetime. Pancreatic cancer occurs most frequently in older individuals and is slightly more common among men than women. The cause of pancreatic cancer is unclear. Risk factors for pancreatic cancer include being male, being African American, increasing age, smoking, being overweight or obese, heavy alcohol consumption, pancreatitis, having diabetes, having a family history of pancreatic cancer, having a family history of a hereditary cancer syndrome, like hereditary breast and ovarian syndrome, Lynch syndrome, familial pancreatitis, and others, and genetics. We mentioned that genetics is a risk factor for pancreatic cancer. Pancreatic cancer is caused by a combination of multiple genes in the environment. It is estimated that approximately 36% of the risk is due to genetic factors, while the remaining 64% is due to lifestyle and environmental factors. Signs and symptoms of pancreatic cancer often are not present until the disease is advanced. When symptoms do occur, they may include the following: pain in the upper abdomen that radiates to the back, jaundice, which is yellowing of your skin and the whites of your eyes, blood clots, loss of appetite, weight loss, and depression. Talk to your doctor about any symptoms you may have. Diseases other than cancer may cause similar symptoms, so your doctor may check for other conditions as well. It is not possible for pancreatic cancer to be diagnosed by genetic testing. To determine whether or not you have pancreatic cancer, your doctor may recommend a variety of tests including imaging tests like CT scans or MRIs, endoscopy, or a tissue biopsy. Since the cause of pancreatic cancer is not well understood, there is no way to completely prevent pancreatic cancer. The following steps may help lower your risk of developing pancreatic cancer. Don't smoke, eat a healthy diet, and maintain a healthy weight. The CPMC report for pancreatic cancer is our first multivariant risk report. The CPMC looked for the presence of 3 genetic variants in 3 genes associated with pancreatic cancer. One variant is protective and associated with a lower risk of developing pancreatic cancer, while the other 2 are risk variants and are associated with an increased risk of developing pancreatic cancer. These 3 genetic variants do not represent your complete genetic risk for pancreatic cancer. There are other genetic variants that influence the risk of pancreatic cancer that have not been evaluated by the CPMC. Now let's talk specifically about the CPMC results and genetic risks for pancreatic cancer. The CPMC estimates your genetic risk for pancreatic cancer based on 3 genetic variants and then compares your estimated risk to that of an average individual. Having an average or decreased genetic risk score does not rule out the risk of developing pancreatic cancer in the future. Having an increased genetic risk score does not confirm a diagnosis of pancreatic cancer and does not mean that you will absolutely develop pancreatic cancer in the future. Non-genetic risk factors like smoking and body mass index, as well as other genetic variants not currently included in CPMC testing, may also influence your risk to develop pancreatic cancer. The table shows how many individuals will fall into each of the possible genetic risk categories for pancreatic cancer based on the 3 genetic variants we tested. Your pancreatic cancer results will tell you about the impact of 3 genetic risk variants on your risk to develop pancreatic cancer. Your risk due to the genetic variants tested will be estimated and compared to the genetic risk of an average individual. Your result interpretation will tell you if your combination of genetic variants is associated with average risk, increased risk, or decreased risk for developing pancreatic cancer. If your result for one or more of the 3 genetic variants we tested was not able to be determined in the lab, then you will not receive a risk estimate. When data are missing for one or more genetic variants, no combined genetic variant risk estimate can be determined. Remember, pancreatic cancer is a complex disease, which means that it is caused by a combination of variants in multiple genes and the environment. Other genetic variants not currently included in this CPMC test may also influence your risk to develop pancreatic cancer. Results of CPMC testing alone cannot diagnose pancreatic cancer or rule out the chance of developing this condition in the future. Risk factors, such as family history or lifestyle, may have a greater impact on your risk than any individual genetic variant or combination of genetic variants. We may learn of other genetic variants that influence your risk of pancreatic cancer in the future. As we learn more, your estimated genetic risk for pancreatic cancer may change. We'll keep you updated on changes through the CPMC web portal. For more information, consider sharing your CPMC results with your healthcare provider. You can also contact a CPMC genetic counselor, read information on the CPMC health condition page, or attend a CPMC educational event.